Hello, my dear friends. Welcome back to our series of presentation, Your Health and Your Salvation. I'm your host, Pastor Morris Law, and we are very happy that you could really join us today. Today, we are going to talk about a disease that's most common in women worldwide, breast cancer. First of all, let us quickly discuss what is cancer. So cancer is a disease in which cells grow in an uncontrollable way and do not work properly. So the cells just keep multiplying. And these cells can really form a mass or a tumor. The mass might be just benign, not cancerous, or it can be malignant, cancerous. And one of the dangerous things about cancer, any form of cancer, it's its ability to metastasize, which is to spread. So cancer cells can spread in nearby tissue and other parts of the body. So they actually metastasize. And that makes it very, very dangerous. So you can have cancer in your breast and it ends up spreading to your brain, to your lungs, to your liver. So that's why cancer is so deadly. So let us look at some statistics pertaining to cancer in general. As you see here, cancer is the second leading cause of death globally. And it's estimated that 9.6 million deaths occurred in 2018 because of cancer. Lung cancer, prostate cancer, colorectal cancer, stomach and liver cancer are the most common types of cancer in men. Breast, colorectal, lungs, and cervix and thyroid cancer are the most common among women. And that's according to the World Health Organization. So we see that cancer is a disease that affects both men and women, and it's very, very prevalent globally. So as I said, I want us to talk a little bit about breast cancer and breast health. So let us now look at the consequences of cancer. Nausea, vomiting, people have to take chemotherapy as one method of trying to really fight the disease. Not to mention the fear, the financial loss because of the chemotherapy. Normally what happens, people lose their hair because the chemotherapy drug is so harmful, and what it does, it targets cells that multiply rapidly. So that's why it attacks the hair cells, because it can't differentiate between the cancer cell and the hair cell. So normally people lose their hair. Not to mention the pain, the weakness. Most of the time people sink in depression and anxiety. There's a loss of control of life. You just find yourself in a situation where most people can't really cope. Surgery is another option, and the worst case scenario is death. So we know that cancer is not a nice disease. And by the way, cancer respects no one. Now, we want to just emphasize the importance of screening. Very, very important when it comes to the prevention of cancer and the control of cancer. And what basically is screening? It's just a clinical test or examination done on a person with no symptoms. So there are no symptoms that appear as yet. So what screening does, it can find cancer cell early when the cancer cell is very small or has not had a chance to start spreading. And that's the key. Some screening tests find abnormal cells before they become cancerous. So screening saves life. Very important, we really stress that screening saves life. So let us go into more detail regarding breast health. And for my audience, we all should know what the breast, the purpose of the breast. It's basically to give milk and nutrient to the newborn. Breast cancer screening is very, very important because breast cancer is the most common form of cancer in women. And it's the second leading cause of cancer death in women. And the mortality rate of breast cancer is about 30%. So 1 in 3 women who contract this disease or is diagnosed with breast cancer will die. So that's fairly high, 30%. The number of women dying from breast cancer, thankfully is decreasing because more and more women are really being proactive. They are becoming more and more aware of their breasts. and more women are getting screened. And it depends on which country, the woman lives. In lesser developed countries, then you find that the rate of mortality would be greater because of restricted access to health care and proper screening methods. 8 out of 10 breast cancers are found in women 50 and over. So right away we see that age is a factor in breast cancer. So women 50 and over should even pay more attention, to their breast health. And 1 in 9 women has a chance of developing breast cancer in her lifetime. Breast cancer is very rare in males. Some men might figure that, okay, breast cancer is only for women. But believe it or not, men also can get breast cancer. But fortunately, it's just rare. About 1% of the cases are actually found in men. So men, you need to be aware too that you can actually develop breast cancer. Now, regarding the anatomy of the breast, of course, we have the ribs, the muscle. This is just a cross section, and of course, the nipples, and you have a lot of fat that surround these lobes. And if we go in a little bit more detail, it says that the breast consists of 15 to 20 lobes interspersed with adipose tissue or fat tissue, and they are supported by ligaments. The functional unit of the breast are comprised of epithelial cells that secrete milk and contracting cells that actually move the milk into a duct, and of course through the nipples. And during the 10-day preceding the menstruation, many women will experience normally the swelling of the breast becomes tender, there is pain, and that is caused by the elevated level of estrogen and progesterone, these female hormones, and that cause the tissues and the cells to become distended. And also you find that water actually accumulates in the tissue, edema we call it, and that the lady will feel some pain. But normally during menstruation, things will go back to normal, right? But if things doesn't go back to normal, then the lady should really realize that something is abnormal. But normally that's what happened to a healthy female when it comes to their breast and menstruation. So let us continue. So cancer of the breast may manifest in a single hard mass, puckering due to fixation of the tumor, and a retracted nipple. So if you have a retracted nipple, that's a very serious sign that you should pay attention to. Or any unusual discharge. If the lady is not lactating or breastfeeding and you have any abnormal discharge from the nipples, you need to really pay attention to that. Mammography can detect tumors too small, for palpation. So, and that is very, very important, because if a lady examines her breast, she might be able to detect the lumps when you have a tumor, but some tumors are so small that it cannot be detected by, palpation. And because of that, it's very important that ladies, consider doing mammogram, because that can really detect the cancer cell when it is too small to be detected by physical examination. It's also important that ladies actually do self-examination, and that should be conducted immediately following their menses or at a regular time of the month for postmenopausal women. So it must be a regular, consistent time of the month. And biopsy must be conducted to confirm the diagnosis and rule out benign tumors. I must admit that when it comes to biopsy in general, and that's one of the risks, because by doing a biopsy, it's also possible that cancerous tissue can actually be released. So there's a little risk there. So malignant or cancerous cells spread at an early stage, and usually to the axillary nodes in the breast. And the widespread spreading or metastasis follow quickly to the lungs, the brain, the bone, and the liver. So just think about that. You end up with breast cancer, and it spreads very, very quickly, and it can go to the brain, the lungs, to the liver, and even to the bone. So it's very, very, pervasive. So let us look at some risk pertaining to breast cancer. Well, of course, it's evident just being a woman, is one high risk. And there's nothing that the lady can actually do. Just being a woman, it's not your fault. Increase in age, as I mentioned before, is a factor. Ladies 50 years and over are at a higher risk. And previous breast cancer, of course, the cancer is prone to really return. And a very important factor too is breast density, how dense the breast tissue is. The denser the breast tissue, the greater the chance of breast cancer, and also for the cancer to really develop, because it's not easily detected even on a mammography. And the use of oral contraceptive is also a risk. It increases the woman's risk of developing breast cancer. And that has to do with the interaction, with the hormones and the hormone balance in the woman because of oral contraceptives. So these are something that ladies should really, worldwide, really consider. And this is just a picture to just kind of illustrate about breast density, as I mentioned. And you see here, for example, this lady has a breast density of 75 to 100%. And this lady on the left, of course, is just 0 to 24. So evidently, this woman would have a greater risk of developing breast cancer because of the breast density. And when it comes to breast density, the lady can do nothing about that. If you are gonna have a dense breast tissue, that's it. There's nothing you can do pertaining to that. So that's why it's so important to really get screened and pay attention to your breasts. So let us look at some other possible risk of breast cancer. Estrogen exposure, Estrogen, that female hormone estrogen, is a risk factor, a contributory factor in developing breast cancer. Early menstruation, so if a female start menstruating early, under the age of 12, the risk or the chance or the potential of developing breast cancer later on in the year is greatly increased. And why? Because that has to do with estrogen exposure. Because the earlier the female start menstruating, of course, the period over which the female menstruate will be longer. And of course, there will be more exposure to estrogen. And it's kind of funny because, in these days, girls are starting menstruation much, much earlier. And many people, many health professionals are wondering why. And, studies kind of indicate and all point to the fact that it's because the food source is contaminated, especially in dairy products, because you have a lot of farmers, because it's just a commercial business, they actually use hormones, to put into their cows and their chickens, and you find that the hormones actually get into the food supply. So you find that, girls who are consuming a lot of dairy products actually get even more estrogen, and that is why they start really menstruating so early, and that is a serious trend. Also, late menopause is another risk factor. So if a lady goes into menopause after she's 55, that just makes sense. She would have been exposed to estrogen for a much longer period of time. Late age at first pregnancy. So if a lady has her first pregnancy over 30 years old, or if the lady never had a baby, that would also increase her risk of developing breast cancer later on. Hormone replacement therapy, HRT. Because what happens is that, for ladies who go into menopause, sometimes the effects and the symptoms of menopause are so difficult to cope with. Hot flashes, irritability, feeling hot, weak, fatigue, and it's just terrible for some women. So because of that, some women will resort to taking hormone replacement therapy, orally. But that increases the woman's risk of developing breast cancer. And one of the great things is that, when it comes to diet, you find that a vegetarian diet will give even, higher protection regarding this, because you find that, especially in soy, you find that you have what you could say nature's estrogen that will actually replace the need for hormone replacement therapy. So that's just something to really consider. And maybe we could talk a little bit about that when we talk about diet towards the end of our presentation. Obesity after menopause is another risk factor. So obesity after menopause is a risk factor, and alcoholism. And despite what you hear from different sides regarding the benefits of alcohol, there is no really positive, upside of alcoholism, really. When you think about it, it does much, much more harm than good. And alcohol is a risk factor, not only in breast cancer, but in other forms of cancer and disease too. So we really urge you and encourage you to avoid using alcohol completely. So let us continue. So remember, and this is very, very important, ladies, extremely important. Most breast cancers occur in women with no risk factor other than being a woman and increasing age. And that is really scary. Just the fact that, you're a woman and your age is increasing, especially over 50 years. Most breast cancer occur in women in that category, right? So that's very, very important to actually remember. So these are just some of the screening technologies that's out there. Digital mammography, MRI, right? Magnetic resonance imaging, ultrasound, and thermography. And the thing about with thermography, not in many countries they use this method, but as Thermo suggests, it has to do with heat. Normally with cancer, wherever cancer is, the cells are multiplying rapidly. So you have a lot of metabolic activity process there, and it generates more heat in comparison to the nearby tissues that are not cancerous. So what happens is thermography will be able to detect those heat spots in the body and be able to really zoom in or detect where cancer is. Very high tech, but it's not a common method of screening. But in some countries, they will actually use thermography. So we really would like to encourage women to consider mammography. Consult with your doctor, right, and see the importance of this method of screening. Let us just continue. This is just an image that just shows that mammograms are able to really detect cancer in a very early stage when, palpation by the woman, physical examination by the woman or even a health professional might not detect, the cancerous mass. When it comes to the matter of screening, I guess it will differ from country to country, but in general, if you are 30 to 49 years, you should talk to your doctor about your risk of developing breast cancer and your risk when it comes to mammography. And there is also some risk regarding radiation. So that's a call that you have to really make. And if you are 50 to 69, the recommendation generally is to have a mammogram every 2 years. And it's your choice. Consult with your health professional. And if you're 70 and older, talk to your doctor about how often you should have a mammogram, right? And there are different opinions pertaining to this, how effective, mammography really is. So it's a decision each woman will have to really make in consultation with your health professional. So we are not really recommending any specific screening guidelines here, from the general conference. But the most important thing is for women to be aware of their breasts, right? And pay attention to their health and be proactive. That's very, very important. The saying, ounce of prevention is better than a pound of cure applies when it comes to breast cancer screening and in fact your health in general. So this is a very, very important point I want to make, or these important points. Women of all ages are encouraged to get to know how your breast usually looks and feel. Be aware of your body, ladies. Know what changes to look for and to feel for. What are the things you should really look for? And look and feel for these changes yourself. Don't just depend on your physician or your health professional, your nurse, right? Look and feel for these changes yourself and be aware of your breast. And any changes that you find or detect, report it right away to your doctor, your nurse, or other health professional, right? Don't wait. Don't assume that it is something else. It's better you go and get it checked out and everything is okay than you make the bad decision and figure everything is okay and find out too late when you have stage 3 or even stage 4 breast cancer. So it's very important that, ladies consider these things to look for. So I want you to pay attention, ladies. Any lump that was not there in your breast, don't take for granted that it's okay. So that is very important. If there is any dimpling, in the breast, any dimpling or shrinkage, that's not normal. If the nipple is actually pulled in, because of course a normal nipple should point outward. So if the nipple is actually pulled in, it could be that that's the site of cancer. So you need to really check that out. Any dripping, and if you are not breastfeeding, and you find these abnormal dripping or secretion from your breast, that's normally a danger sign. You need to go and get that checked out. If there's any redness or rash or any skin changes that's abnormal, you need to really go and check that out. Right, so any abnormal changes, you need to really go and check that out with your health professional, your physician. So the important thing, ladies, is to get screened. Right? So when ladies get screened, breast cancer can be found early, and when you can catch it early, then the chances of survival is greatly increased, and the different options that you have for treatment is much, much better. So it's very, very important that, ladies get screened and pay attention to their breasts. Now, what are some of the things we can do to reduce the risk of developing breast cancer? And I just want to say here that when it comes to disease, God never created human beings to be sick. It's because a result of sin. I'm not really saying that if you end up with a disease, it's your fault. It can be because of your lifestyle, your choices. But there are also other environmental factors that you don't have any control over. For example, we have to go to work. We drive cars in most countries, and there is a pollution. There are a lot of carcinogenic substances in the environment, right? And those things you don't have much control over, except you could go live in the country or just go in some woods. But these are things that we can do. These are things that we have a great opportunity to help ourselves. So these are some of the things that ladies can do to reduce the risk of breast cancer. First of all, eating a well-balanced, nutritious diet comprising of fruits and vegetables, whole grains and nuts. Yes, so we are actually recommending that you actually switch to a plant-based diet, actually a vegetarian diet, right? And contrary to what I was really taught in high school coming up in science class, that a meat-based diet is superior to a plant-based diet because animal protein is superior to plant protein, that doesn't hold out at all. Right, so we are actually recommending that you switch to a plant-based diet. A lot of whole grains and nuts and fruits and vegetables. Avoid eating meat, right? Especially red meat and processed meat. And we're going to see later on in our presentation that the World Health Organization says meat, and especially red meat, processed meat, is carcinogenic, cancer-causing. So avoid eating meat. Avoid processed food and junk food. That's not healthy. And also avoid white flour and sugary food. Cancer loves sugar, believe it or not. And add extra fiber to your diet. And what happens when you have a vegetarian diet? Normally fiber is taken care of. You get enough fiber, but if you need, add extra fiber. And please avoid saturated fats and dairy products. This is a very wonderful way. You not only will help reduce your risk with breast cancer, but it will help improve your overall health, because our diet is extremely important. Of course, stay away from tobacco smoke. You might not smoke, but you might have relatives or friends or co-worker who smoke. Lunchtime, you might want to go, just because of friendship, you want to go out and hang out with them while they are puffing their way, with all of these tobacco. And you find that tobacco smoke has over 4,000 poisonous chemicals in actually the tobacco smoke, right? So avoid that. Be physically active, very important. Be physically active every day and have a healthy weight, maintain a healthy weight, and it will differ from one individual to another. Some people just have a larger body type, right? So maintain a healthy weight, and of course, please don't consume alcohol. Stay away from alcohol. When it comes to cancer in general, we find that the sun and ultraviolet radiation is also a factor, even with skin cancer. Avoid hazardous material in your environment, and there's a lot of chemicals that we have in our homes, cleaning agents, and many of them are actually carcinogenic. And this is critical, ladies. Examine your breast regularly. Make it a habit to examine your breast regularly and report changes in your health to your doctor. Very, very important you do that. And follow cancer screening guidelines according to the recommendation of your physician or your health professional in your respective country, because it will vary from country, to country. Take vitamin and mineral supplements if necessary, especially vitamin E and vitamin B12. And use such herbs as red clover, milk thistle, and burdock root. And when you're taking herbs, you should also make sure you do your research, because different herbs, combination of herbs, can be harmful. So just make sure you actually know what you're doing and do your research. And fresh air, very, very important. In fact, these 8 essentials for good health, very important in helping to really reduce the risk of breast cancer and other forms of cancer and disease in general. Fresh air, sunlight, very, very, very important. I had mentioned already proper diet. Pure water, make sure you have enough water in your diet. And water is one of the best liquid that we can use, the best drink. So instead of drinking all of these sugary, pop and these artificial drinks, it's best to actually use water if we're not having natural fruit juice. And as I mentioned before, exercise and physical rest is also important, to get enough sleep, right? Very, very important. And peace of mind, peace of mind. Stress is a factor, in many, many diseases. And if you find that you're really stressed out and you're not coping well, your chances of developing breast cancer and other form of cancer and other diseases will be increased. And one of the best ways to have peace of mind is to have a proper relationship with God. That's so important, to have a proper relationship with your Creator. It's key. So that is a very important thing I want to really mention. And we need to know and understand and obey the physical laws, because disease never comes without a cause. The way is prepared and disease invited by disregard of the laws of health. So some of the things we can do, simple things, we could avoid overeating, for example. We can reduce the amount of sugar and salt in our diet. We should keep our physical surroundings clean, and personal hygiene is also very, very important. And the bottom line, we should just remember that we have just one body. It's a gift from God. Health is a gift. Health is actually wealth, and unfortunately, most of the time we don't realize how valuable something is until we actually lose it. So I really appeal to you to take care of your health and your family's health. As a registered nurse, I have had experience to work in the clinical setting. I work in orthopedic and rheumatology and also surgical wards, and also in oncology. And it's very, very hard to see human beings really suffering. So I would really appeal to you. Take care of your health, have a proper relationship with God. And as we continue to go through this presentation, I encourage you to join us and continue with us as we explore your health and your salvation. I'm your host, Pastor Morris. Thank you very much for joining us, and see you next time.